Well, good evening. Thanks for joining us here on Mirror Now. You're watching the Sunday edition of the Urban Debate. I'm Afrida Rahman Ali. Well, viewers must have heard that there is a third wave of coronavirus looming large, and it is going to affect children the most. Now, there is a very clear divide in opinion that has come on this from within the medical fraternity as well. There is this assumption that the third wave will affect those below 18 years of age simply because those above have now been covered under the vaccination. So, and India, of course, constitutes 40% of its population in this age group. Therefore, many others are raising concerns on whether you can actually ignore the below 18 age group, which consists of 40% of the population. Do they also need the vaccination cover? Without which, will they remain vulnerable to a third wave? Now, that's the primary issue we are focusing on Urban Debate today. We will, of course, talk about whether a separate roadmap is required for children or not. Some medical experts believe that is unnecessary. A more integrated plan is the need of the hour. Recent data on children getting more impacted has been misinterpreted according to this side of the opinion, whereas on the other side there are some experts who believe that it is always safer to err on the side of caution. Children's lives have been put on hold as well. It's time to focus on them. It's time to talk about how we vaccinate them and how we get them back to school. Remember, they are deprived of classroom learning for way too long, and now this fear looming large about whether the next wave is going to impact them. So all of this have left parents, at least, feeling extremely worried for children in India. We're going to discuss this issue threadbare with two of our experts joining us today. Let me welcome on the show Dr. Chandrakant Lahrariya, medical epidemiologist, expert on vaccines and public policy and health systems. Good evening, Dr. Lahrariya. Good to have you with us on Urban Debates. Thank you so much for joining us. I'm also going to be joined by Dr. Sameer Dalwai, who is a developmental pediatrician and a member of the Maharashtra Pediatric COVID Task Force. Dr. Dalwai will also join us shortly. Dr. Chandrakant Lahrariya, you have, of course, joined us on a number of occasions, and you have made a very strong argument in favor of the fact that there is a false alarm being raised about children getting more impacted by COVID in the next wave. Now, first of all, is there a next wave that is coming, and why should there be one? And secondly, why are you so convinced that children are not the most vulnerable group going forward? Because you've written a piece in the Times of India and you have stated this a number of times before as well. What is your primary argument, Dr. Lahrariya?
So, thanks, Afrida. The first point is whether there will be a third or fourth or fifth wave. So answer is yes, because we know as long as virus is around and as long as there is a susceptible population, the virus will keep circulating and keep infecting people. We know that before the second wave started in the country, through a nationwide sero survey, we were aware that 78% of Indian population was susceptible. However, with this second wave, which was really brutal, a large proportion of population has got either asymptomatic infection or symptomatic infection. So there are assumptions or estimates that around 50 to 60% of Indian population would have developed one form of infection or other form of infection, asymptomatic, symptomatic. Also, people are getting vaccinated. So with the vaccines, we expect that some people are protected. So what we know that by the time this second wave would be over, there would be susceptible population, which could be in the range of 30 to 40%, which would be half of what we had a susceptible population before the second wave. So as long as there are susceptible population, and these population could be in some pockets where the transmission is high, and that can result in the state level wave, but also a national level wave. But we can be assured that because susceptible pool is lower, so the extent of the next wave could be smaller, far smaller than what we had seen in the second wave. So as an epidemiologist, I would say that please be assured that there cannot be the same kind of wave, but there would be a wave. We should be prepared. There would be third one, there would be fourth one. And it's possible that these waves keep going on till entire population is covered from one form of other form of protection, vaccines or natural infection. So we should be prepared for all those. Now, coming to the second part, why children are unlikely to be affected disproportionately. This is a global evidence. We know that in all the waves, children have been affected. How do we know? Through the sero survey. The sero survey conducted across the country have found that the children were infected in the similar proportion as the adults have been infected. But adults got severe disease, moderate to severe disease, they were admitted. Children did not get severe disease. Why? Because children do not have a particular type of receptor which virus need to enter the lung and make them sick. Now, that's the reason that children are protected, but they are not severely infected. Now, coming to the key argument which people often make that, okay,
Okay.
adults have already been infected and there is a vaccination which is happening to adults. But what we need to remember that children are protected through natural infection. So we give vaccine to the people who are more susceptible to severe illness, not to everybody, and that's the reason.
Yes, so these are important points you are making because, I also am curious to know why there is this divide in opinion. But let me first go across to the district collector of Ahmednagar. He's on the phone line with us, I believe. What we're going to do is we're going to try and get an idea of whether there is a reason why this argument picked up momentum. Because what actually happened is that there was one district in Maharashtra, Ahmednagar, where the absolute numbers were quoted of the number of children infected, and that sort of kicked off this entire argument of why so many children are getting infected. Dr. Rajendra Bhosle, District Collector of Ahmednagar, on the phone line with me. Good evening, Dr. Rajendra Bhosle. Can you hear me, sir? I wanted an important input from you on this, since we are looking at the issue of whether children are getting more infected or are more vulnerable. What has been your observation from your district? Are we saying that there were wrong inferences drawn from one district because there was this fallacy of absolute numbers quoted?
See, in Ahmednagar district, say in the month of May, around 86,000 was the total positive patients reported for COVID. And out of that, below 18 years, it's around 9,900 patients. And percentage will be, say, around 11%.
Yes.
So what we consider is children now, as per the new definition, anyone below 18 years of age is a child. So if we analyze this data of, say, 9,000, so 0 to 1 year is around 89 children they are affected. 1 to 10 years is around 3,000, and 11 to 18 years is about 6,700. So this is the statistics. So though these total numbers reported are around 9,900, total death in the month of May below 18 years is only 2. So percentage again comes to 0.02. I don't know if who has analyzed this, who has reported this, but figures are correct figures. And whatever the analysis done by the MK number of children, that is totally wrong. See, it is a normal range. Say around 10% are 15 years. So I think between children, they are their definition of up to 10 years or 12 years of the children. And it is below 18 years is the children. Hello?
Yes, at best, Dr. Rajendra Bhosle, what we can say is that 21st March, the percentage of total cases in Ahmednagar children affected was 8.74. In April, it became 11.65. So there is an increase in the percentage of children infected out of the total. Is that correct?
It is normal range between 10 to 11%. In other districts also, it is the same percentage.
Okay, that's an important point, which is what, in fact, Dr. Lahrariya was also saying. Thank you so much, Dr. Rajendra Bhosle, for joining us and sharing these important inputs, because it's critical for us to understand that the Ahmednagar example was used and it created a lot of alarm. Now, Dr. Lahrariya, you've used this example as well when you talk about your theory about why you believe this is being wrongly extrapolated. Could you explain that to us, please?
Remember that these numbers are correct, but these numbers should be in the perspective. As Dr. Bhosle explained that the 9,000 children were reported to be infected, and this is out of 86,000 of the total cases reported, which around 9% or 11% of the total cases.
Yes.
But we need to remember between 0 to 18 years, and I have looked at Maharashtra number, while for India around 39 or 40% of the total population is 0 to 18 years. In Maharashtra, it's 35%. So against the total 35% population, only 11% infection have been found. Now we look at different way. The adult population in Maharashtra is 65%,
Okay.
but they have found 89% of the infection. So who is at the higher rate of infection? So that's the one point, that we should always examine or review data in context of numerator and denominator. Now coming to the second point, the key is that we are talking
Yes, it might be a
about
little difficult for our viewers to understand. Dr. Lahrariya, just interrupting you for a bit. You are saying that whenever we quote these percentages, it has to be looked in the context of the total population demography. So if we are saying 11% of the children are impacted, we also have to say that out of the total population, 35% of the population are in this age group. And in this segment, 11% are impacted. So you're saying that context is important. I want to introduce Dr. Sameer Dalwai, who's also joined us. Good evening, Dr. Dalwai. Thank you so much for joining us. I'll get a quick word from Dr. Dalwai before I come back to you, Dr. Lahrariya. Dr. Dalwai, you have written a couple of articles as well on this entire issue. And, the Indian Academy of Pediatrics also believe that it is highly unlikely that the third wave will predominantly or exclusively affect children. Are you at variance with this view?
You hear me, Afrida?
Yes, I can. Carry on, Dr.
Okay.
Dalwai.
Good evening. Thank you for this important debate today. I agree that there is no specific evidence so far to say that the virus is now specifically or more seriously attacking children as compared to before. I agree to that there's no evidence for that. However, the plain speak is that in the first two waves, we have seen in the first wave, the senior citizens, in the second wave, adults, and largely people above 25, 30 getting affected. Also, we must remember that this population, segment of the population, has already got largely vaccinated. The one part of the population which is totally vulnerable so far is the population below 18 years because it hasn't got vaccinated either. And we must understand that 18%, when we say below 18, the population is 40%. That translates to 50 crores of our population. The numbers are 50 crores. Now, even if the infection spreads in the same proportion as what we are saying, as compared to the earlier part, and it is the same in children now, but if at all there is a wave, the numbers that we will see on the ground are going to be huge. Again, within that, we are saying very clearly that most of them will be asymptomatic. And even going back earlier, the numbers that we had, even otherwise, we were not testing them because most children are asymptomatic. And that is what I believe Dr. Lahrariya believes as well. However, if we see it spreading predominantly in children, and even if you take the 2 or 3% of children that may turn out to be symptomatic and may require more serious treatment, we need to be prepared. So nobody is saying that there is any more serious threat of the virus to the children than before. But as a community, as a healthcare system, we need to be prepared in case that happens, so that not even one child is found to be lacking medical care that's needed.
Yes, that's a fair point. But, Dr. Lahrariya, since you've also argued in your piece that I read today that there is no need for a separate COVID task force for children, you're saying it is a step, you're going to the extent of saying that could be detrimental since an effective pandemic response requires a single integrated task force. Dr. Dalwai here says, no, we need that special attention because if the absolute numbers are very large, remember, these are children we are talking about. They will again need a parent to attend to them. It's very different from adults. So, a separate force, a separate attention is required to be dedicated to this segment. Dr. Lahrariya, would you not agree?
So I would like to continue with the previous point of Ahmednagar. So there were 9,000 infections reported in Ahmednagar district. But we heard from the district collector that there were only 2 deaths out of the 9,000 cases, which indicate that the mortality in the pediatric age group is really low, and which is a good thing. Now, in the pandemic response, the entire purpose of pandemic is reducing mortality and, of course, reducing the transmission. So we need to, whenever we are talking about the numbers, it will be really important to avoid or to reduce the fear or panic, that we provide entire perspective. The number of infection, number of deaths, and number of deaths in children is really, really low. 0.02% as the district collector had said, and that's what the key thing is. Second part is that the pandemic response require, and it's not only the pediatric ICU which should be increased, but the entire health system need to be strengthened so it can provide health services for all the population. And when we talk about entire health system strengthening, it will be include children also. But the risk with the separate pediatric COVID-19 task force is that often pediatric any task force which is assigned a task, they come up with some of the interventions and which might fragment the resources which are limited, and which essentially may result that there is a lot of attention on the pediatric activity, but it may result in the adult population which is at higher risk of mortality might get a more severe disease, might be ignored because resources are limited.
Yes,
so
I will have Dr. Dalwai respond to that. Dr. Dalwai, will it not compromise your focus on the larger segment which Dr. Lahariya has argued is tenfold higher risk segment? If you divert any sort of resources to children at this stage, would we not diverting resources at a premature stage when you haven't even crossed the bridge, when you haven't even come to the bridge, you want to now focus on children? What is your response to that?
Afrida, when faced with a dangerous enemy at the walls, there is nothing that is underprepared. There is nothing that it can be really over-prepared. We have to be protected. I agree with Dr. Lahariya, but I don't agree with the fact that the same system can continue for children. And I very strongly protest this because unfortunately, most adults believe that children are miniature adults, and that is not so. It may be so in a statistician's book or in a lab while looking at numbers, but that is not the reality. A child has to be treated as with a specialty. It cannot be just extrapolated from adult figures, and I'm sure Dr. Chandrakant would agree to that. You would need special facilities, you would need special experts, you would need special manpower, and you'd still need special medications. So it cannot be extrapolated on a statistician's page. I'm sorry to say that. At the same time, we must understand that nobody is saying,
let Dr. Chandrakant Bhosle come in, someone who's dealing with these issues on ground. Dr. Chandrakant Bhosle, Dr. Samir Dalwai, just hold on. I'm holding Dr. Bhosle on the phone line. I just want him to quickly also talk about this. Yes, Dr. Bhosle, on ground, what is it like? Do children really need that extra care and extra facility as Dr. Dalwai is talking about?
Yes, so in the district we have now proposed one pediatric ward of 100 beds. You has to be prepared whatever the anticipations. We should not only rely on that. We should be fully prepared since there is something that a number of children they are getting affected. So one has to take care for the next wave.
Okay, so the same system as it is for the adults may not work for children. We have two different opinions on it. We leave it at that because I need to move forward on this discussion. Dr. Dalwai, there are quite a few FAQs and I want to bring you in on them. But, you know, the point of the matter is that while there is so much focus, as you have also said, on creating special ICUs for children, on preparing a pediatric task force, where is the focus on getting children back to school? Where is the focus on vaccination? Where do you stand on the issue of getting kids vaccinated? We have held our children back home for way too long. They do not deserve this kind of confinement. They are going through a lot of stress. I can tell you that as a parent. Why is the focus not there on reopening schools? When can we open schools, Dr. Dalwai, in Maharashtra, for instance?
Afrida ji, that's exactly the point. Even if the children are within doors for the last 1.5 years, which in spite of that, we are seeing an increase in the number of cases. If you open up the schools, there's going to be a very big danger ahead. And we cannot open up the schools unless the vaccination has been ramped up to the level that most of the children themselves are protected. And that is entirely an issue of supply and demand right now. And we need to have those vaccines. The last point I'd like to make is that I don't think we will be safe to send children to school unless the largest section of the population has been vaccinated. And finally, there's also always this worry about viral mutation. It may not have happened so far. So I completely grant my dear friend, Dr. Chandrakant Lahrariya, I completely accept his hypothesis. But at the end of the day, when it comes to the medical healthcare system, with all due regard to a hypothesis, even if there is 1% chance that there might be increased problem in children, we have to be prepared. And I have it on record to say that the Honorable Chief Minister has said that I wish that this is not used. It doesn't come to use. And I wish and pray that my friend Chandrakant Lahrariya is perfectly all right. I wish and I pray that he is right. that we don't need to use it. But if at all we have to need it, not a single child in the state or in the country, no parent should feel that my child didn't get the care it was deserved.
But you didn't answer my question on vaccination, Dr. Sameer Dalwai. What is the preparation at that level to expand vaccination to children, or is that going to be a central policy alone? Is the state brainstorming on that as well? You need to cover the children under vaccination as well.
See, that to and fro is going to keep going on till there's a very clear guideline on how much the states can source and get the vaccines. And I'm sure if once the vaccines are available, that is obviously the first priority on the card. But the last point I'd like to say is whatever services are being ramped up for children, they are going to be used for children even after COVID. For example, tomorrow there's a training, statewide training for Anganwadi workers, which is going to include even psychosocial impact on children, even breastfeeding and other parameters. So whatever is being used right now to ramp up the medical health care for children, it is going to be a long-term situation or protection for children even beyond COVID. So I would from the bottom of my heart as a pediatrician say that we must promote whatever can be done for children at all times. No need to panic, but be prepared.
Yes. Dr. Lahrariya, last word to you on this. As a parent, we are worried that our children are not able to mingle with their peer group. They are deprived from classroom learning. Since you are saying that the vulnerability is not as high as it is made out to be, can we let our children mingle then? Where do you stand on that issue? And I think at least on the issue of vaccination, there might be some convergence here, Dr. Lahrariya, since you also argue that we need to focus on vaccination for children now.
So the two parts of this question. The first part is that we need to prepare our health system, but the government should not be focused entirely on the process of setting up the committee, but without committing that what it is going to do. So I argue that the committees which are being set up, they should also clearly outline that what they would achieve in the period of 6 months, how many additional beds for all population, including a pediatric population, how many additional workforces, how many additional activities will be completed. So there should be tangible ideas on how health system going to be strengthened. That's the one thing. Second part on vaccines, my suggestion would be that we should keep the expectations real. When I say what does it mean, expectation real, that we know that vaccines for children are unlikely to be approved before late August and early September. And then only the vaccination will start. India has a big population of around 50 crore children, which means 100 crore doses, and that many doses can be administered over a period of time. So I don't foresee vaccination starting before October 2021, and then it will go on till March, April 2022. So we should keep expectation real, keep reminding that while
until such time, can schools reopen? That is a big question that parents have. Until such time, can children mingle with their peer group, or we have to keep them indoors? These are very big issues which must be deliberated upon. It's not as simple to say that let the children wait, we'll look after them, we'll come to it later, because there is a larger social impact on adults as well to have children confined at home. It is a huge issue. Unfortunately, I've completely run out of time. Dr. Sameer Dalwai and Dr. Chandrakant Lahrariya, it was an absolute pleasure having this conversation with the two of you, and Dr. Chandrakant Bhosle also joining us from Ahmednagar. Thank you so much for your views.